Good afternoon. I'm Jan Mold, one of the Assistant Directors of Competitive Events for hosts of Future Health Professionals. I'm going to be talking today about pregnancy, and it goes along with our Human Growth and Development written test. I know that when I taught clinicals, my students all wanted to go through labor and delivery rotation, and so we usually had to draw out of a hat. The staff there were wonderful to get them in to see both a vaginal delivery and a C-section most of the time. And I know some nursing students that didn't get to see it. But I want to start with you getting a piece of paper out, pen or pencil, and we're going to start with how much you know. So the first questions: how many weeks is a human pregnancy? Number 2, how many stages of labor are there? Number 3, how are the stages of pregnancy divided? Number 4, babies born before the blank week are considered premature. Number 5, at what week of pregnancy would you expect the mother to feel movement? And the last one, number 6, what is a breech presentation? One of the things I've found through the years is that students think they know a lot about pregnancy, but when we really start talking about it, they may not know as much as they thought. So if you'll just put that to the side right now, we're going to find some things out. Normal pregnancy usually lasts 40 weeks. It is divided into trimesters. First trimester, week 1 through 12. And if you think about that first trimester, a lot of times women do not even know they're pregnant until the middle of that first trimester. Second trimester, week 13 through 28. And then third trimester is week 29 through delivery. So those are normal pregnancies. Most of the time they're going to recommend that the woman gain about 25 pounds. So let's talk specifically about what you can experience in that first trimester, what actually happens. First, you have conception with the fertilized egg, which is the zygote. It implants in the uterine wall. The cells become the fetus and the placenta. That placenta is extremely important because it's going to provide nutrients and oxygen to the infant. During this time, there will be a hormone that's released, beta-HCG, and when you do a pregnancy test, that's what they're checking for. So that's the first trimester. Most of the time, if a woman's going to have morning sickness, it's going to be worse in the first trimester and usually eases up at the start of the second trimester. The second trimester, weeks 13 through 28, at 16 weeks, they can usually determine sex of the infant. Now, that's now what they're using. You almost see baby's first picture. A lot different when I had my children and the ultrasound. People would show you an ultrasound picture and it was like, okay. But now it literally is like baby's first picture. 20 weeks, mother feels movement. At first, mother's not probably going to realize during the first pregnancy what that is. It may feel like gas. They may describe it like butterflies. As the fetus grows, it's going to become more and more evident what she's feeling. Survival rate at 28 weeks gestation now is about 92%. And if you'd told me that in nursing school, I would have thought that was science fiction. we've came a long way as far as how early gestational that infants survive. The third trimester, week 29 through week 40, if the baby's born before 37 weeks, it's considered preterm. This is the time when mom's going to feel a little uncomfortable because of the size of the baby, particularly if she's having more than one. It can impact her breathing. Mother will do some things like that's called nesting, where she gets things ready for the baby. You also may hear at this time them say a woman looks like she's dropped. And what that means is that the head has gone down into the pelvis, preparing for birth. So let's talk about the stages of labor. And one of the things that my students always wanted to know about was, what's it mean when the water breaks? And that may be something that happens before the mom gets to the hospital. Basically, there is a bag of fluid, amniotic fluid. That's what they test when they do an amniocentesis. Take a long needle and puncture into the amniotic fluid to do testing. But if the water breaks, that amniotic fluid seeps out, and it is usually a gush. So women know when they have their water has broken. It may be that their water doesn't break and it will be manually broken once they go into labor. The first stage of labor is from the beginning of contractions to full dilation, which is 10 centimeters. And you'll hear people talk about 1 to 10 centimeter. So what they're working toward is to get to 10 centimeters. And that's talking about the opening of the cervix. Labor is divided into two parts. There's early labor and active labor. Usually physicians will tell mothers to come when contractions are about 5 minutes apart. And that would be early labor. Most people, first baby, labor averages about 20 hours. Your teacher may stop the video now for you to do an activity that'll help you learn a little bit about this process of dilation. So now we enter the second stage of labor. It's often called the pushing stage. The second stage of labor is going to end with the birth of the baby. The third stage of labor is after the baby's delivered to when the placenta is delivered. And again, that placenta is something that doctors are going to look at. They're going to look at the arteries and veins to make sure that it has provided the nutrients. It'll give you a lot of information as far as what was provided to the fetus during development. So that's vaginal delivery. Now, I know you've probably heard of a C-section, and there are medical reasons for a C-section. There are quite a few of those, but I wanted to start with an abnormal position. Babies should drop into the pelvis head first. That's a normal position for a vaginal delivery. A breech presentation is where the bottom is first. Share a story with you about a breech presentation. I was teaching LPNs in a small hospital in South Carolina, and they had a patient that came to the ER. Her only complaint was stomach pain. When they went to examine her, they discovered a foot that was hanging from the vagina. So it was what was called a footling breech. She denied any knowledge that she was pregnant. Obviously, C-section was indicated, and that little hospital went on a major alert. Some other medical reasons for C-section may be fetal distress. That could be that the baby's heart rate is dropping, that it's not tolerating labor. It may be that mom's already had one cesarean section. And some physicians automatically do a repeat section for fear that the scar tissue, there will be a rupture of the uterus. It may be mom has chronic health conditions, or it could be what's called cephalopelvic disproportion. Cephal meaning head, pelvis, disproportion means that the head is larger than the mother's pelvis. So, real briefly, that's an overview of vaginal delivery and C-section. So, if you will pull your paper back out, let's see how much you learned. So, 1 through 6, how many weeks is a human pregnancy? How many stages of labor are there? How are the stages of pregnancy divided? Number 4, babies born before the blank week are considered premature. Number 5, at what week of pregnancy would you expect the mother to feel movement? And number 6, what is a breech presentation? I also included a link here that your teacher can share with you if she'd like for you or he would like for you to read more about a C-section. And this is Mayo Clinic's website that gives information about C-sections. Again, thank you for your time. I hope you feel like you know a little bit more about pregnancy.